Hey folks, Doug Blake with Body Design University. In this video, I want to talk to you about blood pressure, or more specifically, a question that I received from a student. Now, I do receive questions fairly regularly on what is considered to be good, low, or high blood pressure. That answer is easy. You only got to do is look up the most recent blood pressure uh, parameters that are out there. American Heart Association. They just changed it a couple of years ago, I believe it was. It, for the most part, for a trainer, for personal trainers, doesn't make that much of a difference. However, dealing with blood pressure and relating to the question that this student had for me, dealing with blood pressure is really, really important. But we also have to, and that's, I'm giving you this one side of it. So we know it's important. That's one of the reasons why we will take a client's blood pressure before they train. For sure, you will take it during the initial evaluation or intake information that you do, what we call a fitness profile. You can call them whatever you call them. If you're working at a health club or another training center, or you have your own business, you might have something, or you should have something that looks similar to a what we call a fitness profile. Again, we're just taking biometric data, figuring out the different parameters of health and fitness that we want to know before we even start training an individual, and blood pressure is going to be one of them. So the question was, should I train somebody with high blood pressure? So I get that question, and you may get that question too. You might actually get it from your client. Now, look, I've got high blood pressure. Is it okay to train? And your answer is going to be, well, of course, it's going to be okay to train. But let me kind of parse this out for you so you know sort of the strategy and the procedures to go through. First and foremost, before you do anything else, is you always do some sort of initial evaluation. And that's going to be an intake form that lists all of their medical conditions, any medication that they're on, and the other pertinent information that we would want to know when somebody signs up for our training services. So you get that. That is always step number one. It doesn't matter. I don't care if the individual is an Olympic athlete. I'm always going to, and that doesn't mean that they're always healthy, okay? But I'm always going to do some sort of intake with them, some sort of information intake on medical conditions. I don't have any medical conditions. Okay, great. Well, then write that down for me because you're going to sign your name to it. Or yes, I have high blood pressure. Now, wait a minute. Is it diagnosed hypertension? So that's the first thing. So remember, I'm just answering a question. Should I train somebody with high blood pressure? Okay, first and foremost, you would know if they had hypertension. Now, when I hear somebody tell me high blood pressure, I've got to, and you've got to, as a trainer, you've got to discern. When you say high blood pressure, are you talking about your understanding of high blood pressure, something you read, and then you did your at-home blood pressure monitor, however you did it, and then you diagnosed yourself? No, I'm not interested in that. I want to know what your doctor said, and your doctor would give you a clinical diagnosis. The clinical diagnosis is not high blood pressure. The clinical diagnosis is termed hypertension. That's what they have to write down and send it off for reimbursement to the insurance company. Otherwise, it's not a real condition, but they will give a determination of either elevated or, hypertension stage 1 or 2, whatever the case, however they want to put it. But generally, it'll be hypertension. Then they might put a designation on it. So step one, do I train somebody? This is the question. Do I train somebody with high blood pressure? Of course, the answer is yeah, of course. However, this was the first thing you did. You determined whether or not they have been diagnosed with hypertension. And if they have, you need to know what that is. Okay, so this is the second thing. If they have been diagnosed, before I ever start training them, they have been diagnosed with hypertension, whatever level, you need to know whether or not they have it controlled with medication and lifestyle changes. Is one of the reasons why we're happy people with high blood pressure come to train with us. Their doctors are probably happy now that they're starting exercise. They call this lifestyle behavior change or management. And that's exactly what we want people to do, is to start exercising, change their nutrition, lose body weight, yada, yada, yada. There's all that stuff. So the second thing we're doing is we are asking and making sure that if they have been diagnosed with hypertension, that they are managing it. And remember, just because you've been diagnosed with it, yeah, I need to know that it's being managed. And generally, I'm not saying all the time, generally, they will be on some sort of blood pressure medication. I don't know which one it's going to be, but they will tell you. If they have it, look at it, or just ask them what it is, write it down, make sure you understand whether it's a beta blocker, ACE inhibitor, something like that. You need to know the actual med that they're on. That's the second thing. Is it being managed? And if it's not managed, you need to then say to them, I'm going to need a physician's write off that you are okay to train, because if you're not managing your hypertension, then you could have a problem, maybe. So I need to know that that's the case, that your doctor has essentially signed off. So it's called the physician release, if that is the case. Third thing is to make sure that, again, for the most part, you or your client are taking regular readings of their blood pressure. Anybody that knows anything about hypertension will tell you, and I'm talking about physicians, monitor your blood pressure. You monitor it at home. Take your blood pressure every day, every couple of days, just to make sure that it's in line with what your physician wants it to be. So all of that, those three things, right? Just to now get to answer the question. And the answer is yes, of course. But this leads to another more important question, which is, what is the individual's blood pressure at the time they come in to train? I have hypertension, it's controlled. Generally it runs whatever the number is. I'm just going to throw a number out at you. It's generally runs normally for this individual 125/85. I don't know, right? Whatever that number is. If that is their quote normal, because they do have diagnosed hypertension, then you're going to use that sort of as a base or standard for when they come in. Now, remember, we're not clinicians, we're not doctors, so we're not going to take people's blood. Although I know trainers that do this. Come on, if you have been diagnosed with it, every time before you train, go ahead, let's take your blood pressure. I don't normally do that. Never really did that unless the individual was guided by their physician to do it. Then it's not a bad idea. So you might want to consider that. Now, that's how you then know, are they okay to train? Because what are you going to do now? This gives me a great opportunity to go over some of the basic numbers that we have for blood pressure. And just so you know, these numbers, you can Google them online. They're easy to get. And it's really going to be the higher numbers that you're concerned with. What we call a hypertensive event, or really, really dangerous high blood pressure, where you would need to go to the ER, goes up into the systolic 180. Now, again, these are standard numbers that are used. It could be lower, a little bit lower than that, but the standard numbers that are used is a systolic, which is the top number, of 180 or higher. If your blood pressure when you walk in to train with me is 180 over anything, that's a concern. That's a huge concern. The lower number, or the diastolic number, the number there is going to be 120. So 180 over 120. This is like, whoa, this is like, get to the doctor, get to the emergency room. By the way, I've seen people with blood pressures at those levels, and they're on medication and they forgot to take their meds. And they've come in. I remember one gentleman in particular, his face was kind of red. He wasn't even training, overweight, and he didn't look good. So that's when I immediately took his blood pressure, and it was skyrocket. I mean, it was really too high for my comfort level. And I said, I'm not going to train you. Just please go. I would go to an urgent care, emergency room, or call your doctor immediately. And basically what it was he had not taken his medication. Now, I'm just saying that if I had trained him, does that mean I would have hurt him? I don't know, but why take the chance? So the answer to the question then is when you take somebody, here's the deal. If you take their blood pressure, now you got to make a decision, right? This is one of the reasons why because we're not clinicians, we don't really want to step too much into, well, your blood pressure is 150 over 100. Are you a doctor? Is that good? Is that bad? I don't know. Once again, having trained 1,000 people, if I've trained one with diagnosed hypertension, there are individuals whose blood pressure regularly runs 140 over 95, 140 over 100. That's their normal. And I spoke to their doctor and said, is this okay? He's like, yeah, that is their norm. They're on meds. The meds are pulling that down from normally 160 over 110. It's pulling them back down. So can I train them? Yes. On the other hand, you can get an individual with that same blood pressure that this gentleman has, which seems high, but for that individual, it's normal, but it's way too high for this individual. That's when I would be a little cautious about training them. But you get the idea. To simply say, yes, you can train them, or no, you can train them, brings in a number of different issues that you have to take into account. So let me make it simple for you. If the individual that you're training is diagnosed with hypertension, you need to know what their norm, quote, norm is while they're on medication. And you can always reach out to their physician if you need to make sure that your client, their patient, is training in the proper range. And then, if that is the case, I always err on the side of training at a lower level of intensity, particularly with resistance training. If they're holding their breath, things like that, you could potentially cause a rapid rise in their blood pressure that could be problematic. Okay, so you get the idea. I know that they are diagnosed hypertension, so I'm going to be cautious, conservative on their training right off the bat. I need to know if they're taking their meds, and then I need to take their blood pressure just to say, okay, this falls within the guidelines of what your doctor says was okay and what we're seeing from your norm. Then there is the extreme where it doesn't matter who they are. If you see somebody's blood pressure getting close up near the 180 over 120, boom, that's a clinical issue. That's something that they need to take care of. I would not train them, send them off. And I don't think I've ever had it that close, but I've had a couple of times where I've had people at those levels, but they came in with those levels because they had not taken whatever blood pressure meds they were on. So make it simple. You know it. So should I train somebody with high blood pressure? The answer, of course, is in the general broad scheme of things, of course. The only time you would not is when you, as the trainer, you discern that maybe they don't look too good, and then you take their blood pressure and you would know if the blood pressure is too high acutely at that time. Hope that makes sense. If their blood pressure is slightly elevated from their norm, no, it's probably not going to be an issue. But now you've got your standard training protocols that you're going to use anyway, which is not holding their breath, not training with excessive resistance that's going to cause normal increases in blood pressure. Again, the Valsalva effect, that holding the breath like this, that will definitely raise blood pressure. You're ensuring that this individual is not too far out of their norm while you're training them, and then you're monitoring water during the workout, sweating. These are the things that you would already know because we use the look test. And again, I'm not talking about cardiorespiratory training and looking at ventilatory threshold 1 or below. I'm talking about the look test, which is a standard sort of qualitative test when you're training people. When people are sweating, their face is getting red, or they're really huffing and puffing. Okay, that's an issue that you might want to rectify right then and there. So again, bring the question back around. I'll do it again. Do you train somebody with high blood pressure? Yes, but the answer, but to really understand the yes or the no on this is, what is their norm for their blood pressure? Again, I don't remember too many times where I would have said to somebody, you don't look too good. You feel okay? Well, no, not blood pressure, and I'm going to take it. Your blood pressure is running a little high right now, from what I can tell, and from what I have written down for you. It might be a good idea to reconsider training and then go check with your physician, right? And then you'll get the, well, I didn't eat anything. And it could be a blood sugar issue or yeah, I forgot to take my meds over the, get the idea? By the way, you as a trainer, in some cases, you're the only accountable factor they have, maybe outside their family, spouse, or whatever the case is. You might be the only accountable factor because I know my clients that are diagnosed hypertensive. Of course, I would know that. Did you take your meds? How are you doing on your medication? All of it, every time they come in, right? And if you've seen any of our other videos when I talk about nutrition, it's the same thing. How are you doing on your meal plan? Did you eat this morning? Did you eat this afternoon? When was the last time you ate? Write that down. Write that down. That's your job as a trainer. The coaching component that is so critical to what we do in this industry, it's critical that you ask these questions. High five, elbow, whatever, I don't know, whatever you're doing, but you ask them these questions. How you doing on your meal plan? Did you do your cardio yesterday? Right? Did you take your medication? If you have diabetes or if they have hypertension. Hope that makes sense. So do I train? Of course, absolutely. We want people with high blood pressure to train. If their blood pressure is acutely, meaning when they walk in, if they have an acute elevation in their blood pressure, that's on you. That's you making a determination. And generally, it's not going to be to the point where they're having a hypertensive crisis, 180 over 20. I mean, if that is the case, oh, you'll know. Some people, you'll see it. Face will be red, right? They'll be even in some sense agitated. Some people won't even show to any great extent. The point is that I've got blood pressure monitors I can know right off the bat. Take the blood pressure. It's 140 over 95, 140 over 100. Well, I look and I know that their norm is 130. Resting is 130 over 90, 92. Well, they've been working all day. They're driving their car. They come in. Of course, their blood pressure is going to be elevated, more than likely. And that's when I make that decision. Okay. As to whether is it that high? Probably not. But this is the situation you find yourself in. Please, your scope of practice determines you cannot make clinical decisions unless you're a clinician. So if you are, okay, well, then good for you. But I wouldn't do anything related to diagnosis of a condition. Now, if a person comes in and they don't have high blood pressure, they're not hypertensive, they've never been diagnosed with it, doctor says I'm good, their normal resting blood pressure is 120, 119 over 80, right? Which is, anything below 120 and below 80 is considered normal now. Okay. If that's the case and they walk in and they're like, I ain't feeling too good, Doug. Did you eat? Yeah, I ate, but man, it was stressful at work, blah, blah, blah. Come on, sit down, do a quick blood pressure test. 150 over 100. You get what I said? 120 over 80 is their norm, and now they're at 150 over 100. Am I a doctor? No, I just play one on TV. No, I'm not. So I can't make any designation. I would be concerned because of how they feel. Get the idea? It just from what they're telling me. And now I'm correlating that with an actual biometric. I'm not going to take their blood sugar. I'm not going to do any of that. But what I'm going to ask them are some more questions. Did you eat? Did you drink? Have you been hydrated? Did you sleep well? Blah, blah, all these questions that I can now ask. And I corroborate that with clearly a elevated, acute, elevated blood pressure of, like I said, I'm just using a number, 145, 150 over. That's clearly way out of the norm for them. I might consider, probably not a bad idea to go get this checked out. Have you ever had it this high? No. Look, again, I can train you. I can do certain things. You may not have any issues, but I would play conservative on that. and have them go seek medical assistance. Again, this is a decision you have to make. And I'm not giving you clear, the only time you ever get a clear, definitive no, like not even close, get out of here, go to the doctor, is if their blood pressure hits the what's known as a hypertensive crisis, 180 over 120. At that level, I don't care who you are, go get medical assistance. Up to that point, it's your decision. You gotta make the judgment call on that. And with that, I hope that was helpful. At the end of the day, your scope of practice, you can't do certain things, and you definitely don't want to be making certain decisions. Oh my goodness, 130 over 90. Ooh, you better go to the doc. No, I don't think I've never done anything like that. I know for me, having the experience, seeing more and more people and having spoken to many, many physicians, general understanding is that it's only when it starts getting upwards and upwards and upwards to the 180 over 120 level, that's when you start to become more and more conservative about how you move forward. So to answer that question that this one student have, I know what the student was referring to is, what if their blood pressure is really high when they come in? I hope I've given you enough on the explanation of that to help you with it. So as always, please keep in mind, if you want to become a qualified, certified personal trainer, click on the link in the description box below. If you have not already done so, please subscribe to our channel. If the video was helpful to you, of course, give it, right, what's it, 2024? Don't we all know the whole YouTube? Subscribe, like, share. Isn't that what it is? Something like that. Subscribe, like, and share, right, to your friends and your family. As always, if you have questions, just write them down in the comment box and let us know if the video is helpful by typing the word either understood or great job, Doug. That's always a good one. Just let us know how we can be of assistance. As always, it's a pleasure bringing you these videos. Let us know how we can help you out. Have a great week. Bye.